Hi, friends. Today I have the honor of introducing to you Dr. Kritika Chauhan. Now, Kritika is a very, very proud Damsonian and a very, very happy girl today. And why is she happy today? Because she has passed a big kind of a mental barrier that we all have. We all see that when students are studying abroad, they have this, thought that ek bar, once FMGE is done, then life will be easy and all that kind of barriers, and especially with the background of COVID. Kritika, we want to hear from you. How are you feeling today, and what was your reaction when you saw the result?
I'm like on cloud nine right now. I'm super happy, and I was so afraid to check my result that I asked my friend that you check it. I can't check my result. So my friend called me and he told me that okay, you passed. It's been 2-3 days that we have got our result, and every day still I'm checking that okay, this is my name, this is my roll number, and I have passed the exam. So
I know,
I'm
and
really
now
happy.
once this sinks in, I want to know, and I'm sure the listeners also today want to hear from you and understand. Okay, can you do a check back and tell us, before the exam kind of mindset and after the exam? मतलब do you think कि एग्जाम से पहले हमने बहुत ज्यादा हाइप बना रखा था और एग्जाम के बाद अब लग रहा है इतना बड़ा नहीं था कि जितना हमने प्रेशर बनाया हुआ था अपने ऊपर? कुछ मतलब बताना चाहते हो फ्यूचर एस्पिरेट?
Definitely, sir. Definitely, sir. The thing is कि पहले the thing is exam difficult तो I mean सबके लिए होता ही है obviously. After exam when you clear it, it's like कि ठीक है इतना भी कुछ नहीं था. Okay, you have done it now. But obviously when I was preparing for it, every single day I used to be like कि okay, now I am gonna give it up. Now it's done. I can't do it anymore. I can't take it. Every single day I used to face this feeling. But then I used to watch somebody's videos or motivational thing, or my friends. They helped me a lot to cope it up with it, and especially COVID. Oh, and we couldn't go to our universities, and staying at home, mental pressure, parents pressure, and batchmates they're clearing the exam. So all of those things that really took a toll on me. But fortunately, I cleared it this time. So I hope everybody else they also clear it. That's it, sir.
Definitely. And you have been a DAMS student, so any fond memories of your DAMS journey today when you look back?
Oh, sir, I when I was a DAM student, I was in vacation batch. So at that time, classes used to be like from 9 a.m. to 9 p.m. And I live in Delhi, so I couldn't be like that. I can take another apartment or any place else in Gautam Nagar. So I had to travel from Uttam Nagar to Gautam Nagar every single day. There was some time that I used to reach my home at 11:30, and then again next morning I used to get up at 6 o'clock and then reach the classes. So that was a very hectic time. But I loved many professors. They were like so good. And before
And when you now look back, and were you happy with the quality of the teaching and the notes that the teachers had given you in the classes?
yes,
And
yes.
when you saw the paper, when you look back now, do you think they were at par with the level of the exam?
Yeah, definitely, sir. The notes are the most important thing. Like my juniors, they were asking me, "The now you tell me what are we supposed to do now?" So I don't know. Nobody told me. Like even in dance, teachers used to tell me that focus on the notes, focus on the notes. But apart from dance or I mean coaching things, people they focus on question banks. But I hope I would have like focused more on my notes. Like notes are the most important thing. Just focus on them because I didn't do it before, but later I got some senses, so I focus on my notes so much. Really, and even in classes, they give you a lot of time to write and jot down everything. So the notes are really good.
And you have been a DAMS classroom student, and now you'll be happy to know that now all the DAMS courses are available both live as well as recorded on the eMedicos app. And also, one of the things that I wanted to point out for your juniors is that we know that in upcoming years, the FMG exam will be merged with the next exam, and things will whenever the change comes, we need to preempt it and prepare ourselves, because there is a talk, and I'm sure most of you have seen the white paper where the NMC has mentioned a window of 2 years to pass the next exam. So it is
Yeah.
important to start studying early, and
Totally,
you know,
sir.
it is important to, you know, like not wait till the time you come back to India and study. You have to
No, no, no.
start
This
a little
is
early.
totally. Yeah, that's what I told my juniors. They were asking, what are we supposed to do now? I was like, don't wait till the end, because at the end it gets so difficult because the pressure is so high. When you start from the beginning and start preparing from the beginning, then the things are like they get quite they get quite easily. Not, I can't say easily, but okay, you can handle that pressure. But if you start late, the subjects are so much. The content is not difficult, but the content is so much. So that's why we are supposed to start from the beginning.
And Kritika, you know, I will also want you now to quick do an analysis of this year's exam. Like, you know, there would be listeners who will be appearing in future exams. So, what did you find in this paper? Like paper one, paper two. What was the, you know, let's analyze the paper one. What was the subject-wise distribution? Was it, you know, up to the your expectations? Any one-liners or clinical questions, visuals? Can you do an analysis of the paper for future aspirants?
Yeah, sure, sir. Like according to me, like in the before exams, there were like so many pictures, like photos. But this time there were like very few photos were there. Everything was like concept based, and many one-liners were also there. That's not a problem, because in first paper was kind of fine. In PSM there were like so many questions, but out of syllabus. I mean, out not out of syllabus. You can't say that. Out of, like, I didn't know a lot of stuff, because you can't know everything in PSM. They can ask you anything. So I think that was the first paper. First paper was okay for me, and in second paper I found a lot of these things, OBG and OBGY and surgery and medicine questions were there. And we usually skip treatments and everything, but this time they asked a lot of treatments. Especially I skipped that part in my when I was preparing for it. I skipped the staging thing, but there were a lot of staging parts. So I would like everybody to just go through the staging, cancer staging. That is very important. And because being I'll be doing starting my internship now. I haven't done my internship yet, so some questions were very clinical for me. But if you are very thorough with the theory, so you can easily relate with the clinicals.
Great.
And
And
ENT optha were
any,
also there, so
yes, you know, one of the things that I wanted to point out was that ENT, ophthal, and I think medicine, surgery, obs, gynae, PSM. I think good chunk of questions were there from these subjects.
so many questions were there, sir. Yeah.
And you know, this could be a like a indicator for future aspirants also, that like don't miss out on the bigger subjects. Like sometimes what
Yes,
happens is,
definitely.
you know, you may be just focusing on these shorter subjects, while the chunk of the questions, because you need to pass the exam, and
Totally.
that is where, you know, you have to get the majority of the like usual questions right. And one
Yeah.
of my observations this time was that this time the paper had a lot of usual topics, like a
Yeah.
lot of questions which were like predictable and were predicted by the teachers and the classes, and you were able to
Totally,
like
sir.
you know, feel a sigh of relief. But
Totally, sir.
even when we look at this, you know, the passing rate this time is better than the previous time. But
Yeah.
if we look at it overall, it is like I think around 25%.
Hmm.
So you know, when I ask you now, when I look at it and I want you to analyze it, do you think that like the mixture of conceptual studying and making notes and practicing question is better than only doing questions now? When can you know, like I know it is like
No, no.
difficult to
Yeah.
analyze, but I see a lot of foreign medical graduates, they focus when they have short time, the 3 months 4 months, they think let's do only some questions. And do you think that your approach of making notes and question was the ideal thing?
Yes, sir. Because I've seen many stuff, like even like while I was attempting question banks. So just because on the basis of question banks, you can't just clear this exam. Nobody can do that, because if you don't have the knowledge about what they are asking you, you can't clear this, because there are like four options, right? So you can't just select this. Okay, this one is right. You are supposed to know other options also. So, but according to me, I think like 60% notes and 40% question banks. That is the must thing. And even you can't just focus on only on notes, because how will you attempt the questions if you are not practicing the if how will you if you're not practicing the questions enough? So 60%, 60 and 40 thing, I think according to me, I did that. So I think hopefully the other aspirants can also do that. And every time they are changing the concept. Last time they were like so many questions, photos only, and this time a lot of theory questions. So you can't just take, okay, this time it came, next time it will come. So I think and according, when you said that we are not supposed to leave any subject, totally, sir, I get it. Like at least twice we are supposed to revise the subjects. At the end, you can choose to leave any subject, right? But at least twice you just read those subjects. That's it.
Great. And I think, you've brought up a very good point, and I totally agree. 60/40 is a very good time ratio to be divided. Your study time, 60% should be spent on conceptual part. It could be notes, classes, it could be attending a lecture, it could be like reading a textbook, but 40% MCQ. 60/40 is a good ratio, and usually it works.
Yes,
And
sir.
do you have your parents around, or
I mean,
family
they are
around?
not here. Actually, I'm at my grandparents' home, and
Okay.
my they were like
Do
so
convey my,
happy.
do convey my regards and congratulations to them, whenever,
Definitely,
you
sir.
get a chance.
Definitely, definitely, sir.
I think grandparents would also be very excited about it, I think.
They were really excited. My cousins and everybody, they got me a cake and everything. We had a huge celebration and everything. Like my parents are they are in Delhi right now, so I'll be going to Delhi tomorrow or day after tomorrow. Then we'll be having celebration there.
Great. And, final quick message by you for future aspirants. Anything you want to tell the future aspirants that, about the motivation, or, anything that you may say that might, motivate them or recharge them. Also, a message for students who may not have done well this time. Anything you want to say to, all the people who will be appearing in the December exam?
I'll just say it's okay, guys. It's not the end of the world. I totally understand you think that it is the end of the world, because I was in the same place. So, but right now you may be thinking, ये तो ऐसे ही बोल रही है, इसका हो गया है. But it's not true. सच में. Like just focus on your things, trust yourself, because when you're preparing, you get lot of material that you do this, do that. Just trust your notes. Whatever you're studying, just do that. Stick to your stuff. Don't go इधर उधर कि ये भी कर लेते हैं, ये भी कर लेते हैं. Don't do that. Stick to your notes और पहले से prepare करना start कर दो please. एंड में बहुत प्रॉब्लम होता है, बहुत. The mental pressure is so much that when you are like even preparing for the exam, it gets too much. So अभी कर रहे हो, करते रहो. और अब for the people who couldn't clear it, I'm really sorry for you guys. और नेक्स्ट टाइम कोई बात नहीं, 6 महीने बहुत डिफिकल्ट होता है. मेंटल प्रेशर, मम्मी पापा का प्रेशर, स्पेशली प्रेशर कि हाँ सबका हो गया है, हमारा नहीं हुआ है, वो बहुत ज्यादा लगता है. कोई नहीं, हो जाएगा तुम लोग का भी.
On this positive note, and, on this, with a very positive lady who's going to become a great doctor in future, any, aspirations for future, now that, your first hurdle is gone, now you have now cleared the FMG exam? Anything about future that you are, visualizing right now, that ये मुझे आगे ये करना है, ऐसे बनना है, ये करना है, कुछ सोच रहे हैं?
Future, so I don't know. Right now I'm like in a trance right now, because the thing, when we clear the main thing when we clear this exam is like to get your dignity back, because every time people say you are a foreign medical graduate, पैसे देके करके आए हो, ये वो. But now that we have cleared this exam, so I can say, okay, I might have taken the admission, but okay, I cleared the exam also, so I'm kind of worth it. So abhi right now, and I'm focusing on practice, like becoming a good doctor right now. I'm not focusing on PG or anything. I'll be choosing some internship. I don't wanna just get into books again. I just want to go out and get my hands dirty. That's it.
I'm
That
sure,
is my
you
only
will.
inspiration right now.
I'm sure, you'll do well in life, and I'm sure you will, now that this, what happens is when, before the FMG exam, what happens is you are under a lot of pressure, because, you look at your parents. Sometimes, they will also be having questions from relatives, because, you keep hearing कि पिछली बार result अच्छा नहीं आया, उससे पहले ऐसा हुआ, and all that pressure is there. And I totally appreciate this, that, now you're looking forward to a great medical career ahead. I wish you all the best, and we'll make a
Thank you so
customary
much,
V
sir.
sign of DAMS. We'll make a V
Thank
sign
you so much.
together. And thank you very much. Best of luck in your future,
Thank you so much,
endeavors.
sir.
God bless you, beta. God bless you.
Thank you
Bye,
so much,
beta.
sir.